Vitreous. Vitreous anatomy. Into anatomy, it is a transparent or jelly-like structure that fills the posterior 4/5 of the cavity of the eyeball. Here, this is vitreous. Its volume is 4 ml in volume. Then there is cortical vitreous. Cortical vitreous is a condensation of collagen fibrils in the peripheral part. It forms a false membrane. Anterior hyaloid membrane. Here, this is the anterior hyaloid membrane, and posterior hyaloid membrane. This is a posterior hyaloid membrane which lies anterior and posterior to ora serrata respectively, anterior hyaloid and posterior hyaloid. Then there is a main that is cortical vitreous. Then there is main vitreous body known as a nucleus. Vitreous body known as a nucleus. It is running down from the center of the vitreous body. See here, running down from the center of the vitreous body from the optic disc to the posterior pole of the lens. This is a hyaloid canal, also known as a Clockett's canal. This canal is a hyaloid canal or Clockett's canal. Now vitreous base, that is a hyaloid canal or Clockett's canal. Vitreous base, next is vitreous base. Vitreous base is attachment across the ora serrata. This is a vitreous base. Attachment across the ora serrata is a vitreous base. Then where vitreous attachment, here the vitreous attachment is the strongest. Okay, it is the strongest here. Next is a hyalodocapsular ligament of Weger. This is a hyalodocapsular ligament or the Weger's ligament. It is the adhesion of the vitreous to the posterior pole of the capsule of lens. This is a Weger's ligament. Adhesion of the vitreous to the posterior pole of the capsule of lens. The circular line of adhesion is called Weger's line. And next is a Berger space of Berger or the Eaglet space. Within the circle, there lies a potential space of non-adhesion between the vitreous and lens. This is the space of Berger. Okay. Next, coming to vitreous degeneration. First one is vitreous liquefaction or synchisis. Okay, this is the most common degenerative change in the vitreous. Then next is vitreous collapse or syneresis, also known as syneresis. Vitreous degeneration, liquefaction is synchisis and vitreous collapse is syneresis. Then muscular volitens is there. It is physiological opacities represent primitive hyaloid vasculature. These are opacities, okay. Physiological opacities. They represents the residues of primitive hyaloid vasculature. Next is asteroid hyalosis. This is asteroid hyalosis. We can see the small white rounded bodies in the vitreous gel. This is asteroid hyalosis. It is due to the deposition of calcium containing lipids. Asteroid hyalosis. Okay, so vitreous collapse, muscular volitens, asteroid hyalosis. Next is synchisis indolens. Synchisis indolens. It is vitreous laden. See the vitreous. This is synchisis indolens. It is vitreous laden with small white angular and crystalline bodies. It is formed of cholesterol. This is synchisis indolens. It affects the damaged eye that have suffered from trauma or vitreous hemorrhage in the past. Vitreous is liquid and the crystal sinks to the bottom here, and but stirred up with every movement, which appears as this beautiful shower of golden rain on ophthalmoscope. Synchisis indolens usually affects damaged eye, the eyes which have suffered trauma, vitreous hemorrhage in the past. Vitreous is liquid and crystal sink to the bottom, and it stirred up with every movement. Then which appear that movement which appear it is called as a beautiful shower of golden rain on ophthalmoscopy. Next is amyloid degeneration. These are the vitreous degenerations. Now coming to vitreous detachment, there is posterior vitreous detachment. It is most senile. It is a senile phenomena. It is a most common age-related change in the vitreous. Then it is also common in diabetes. It's common in diabetes. Occurs early age in myopes. At an early age in myopes. Then there is sudden onset of photopsia. There is a patient will complain of photopsia, sudden onset of photopsia. That is photopsia is nothing but flashes of light. That is because of the traction here. Because of the traction on the vitreoretinal attachment, it irritates the retina, causing it to discharge electrical impulses, which are interpreted by brain as flashes. It is a condition, flashes of light is a condition characterized by perceiving a sensation of flickering of light. It is also called a flashes of light, that is photopsia. Then there will be ring like opacity. These ring like opacities is known as a V's ring or the Fuchs ring. It represents a ring of attachment of vitreous to the optic disc, which is pathognomic. This is a V's ring, it is pathognomic of posterior vitreous detachment, also known as the Fuchs ring, V's ring or Fuchs ring. Then anterior and basal vitreous detachment can occur secondary to trauma or vitreous hemorrhage. It can be accompanied by vitreous hemorrhage. Now coming to next one is vitreous hemorrhage. Vitreous hemorrhage causes trauma is the most common cause. Commonest cause in young, most common cause in young, and diabetic retinopathy is the most common cause in elderly. Then there can be other inflammatory diseases like acute chorioretinitis or periphlebitis retinae. Then vascular diseases like hypertensive retinopathy or central retinal vein occlusions. Then blood discrepancies like retinopathy of prematurity or leukemias, polycythemia, sickle cell retinopathy, etc. It can be a lot of causes for vitreous hemorrhage. Then it can be idiopathic like in Eales disease. Clinical features include in vitreous hemorrhage include a small vitreous hemorrhages usually causes sudden development of floaters. Floaters are black spots in front of the eye and diffuse blurring of vision. Sudden painless loss of vision is usually seen in massive vitreous hemorrhage. Sudden painless loss of vision will be seen. Now in distant direct ophthalmoscope, black shadow against a red glow. If a black shadow is seen, then there it is usually suggestive of in the red glow. This is the distant direct ophthalmoscope. Usually there is no glow. This is a red glow. There is no glow in large hemorrhages. If the hemorrhage is small hemorrhages, then we can see these black opacities here. This is in distant direct ophthalmoscope. Ultrasound B scan is helpful in diagnosing vitreous hemorrhage. This is the ultrasound B scan. Image of ultrasound we can see here the vitreous hemorrhage. It is helpful in diagnosing. Now coming to treatment is initially we do conservative management, bed rest and head elevation to allow the blood to settle down, and head elevation. Then we can treat the cause once blood settles down. If hemorrhage is not absorbed even after 3 months, then we go for pars plana vitrectomy. If there is early vitrectomy is done in case of trauma and if it is associated with retinal detachment. Next is Terson syndrome. Terson syndrome is a combination of intraocular bleed, we can see the intraocular bleed, and subarachnoid hemorrhages to aneurysmal rupture, most commonly arising from the anterior communicating artery. That is a combination of intraocular bleed and intraocular hemorrhage and subarachnoid hemorrhages. Usually the most common artery is anterior communicating artery. Now coming to pars plana vitrectomy. Pars plana vitrectomy, it is a divided system approach, usually done in case of severe persistent vitreous hemorrhage. Most common indication is this one, persistent vitreous hemorrhage. Now we do 3 sclerotomies here, are made at pars plana. That is, we do it in at pars plana, that is about 3 to 3.5 mm away from the limbus. Here, one is used for infusion. One port is used for infusion of balanced salt solution. Then this is one is used for fiber optic, to provide fiber optic light source to provide illumination, light source, and one is for instruments, vitrectomy instruments for suction and cutting of vitreous. Next is vitreous substitutes. The most common vitreous substitute used are air. Most commonly nowadays we use S6 sulfur hexafluoride or octafluoropropane, that is C3F8. Gases are used. Then silicone oil can be used. Others are air. Air is also used. Then ringyl lactate. Physiological solutions like ringyl lactate, sodium hyaluronate, donor vitreous or perfluorocarbon liquid.